Hello, my name is Michael Uy, and today I will be talking about albinism and the different types of albinism. I will explain the causes, any side effects, complications, the long-term outlook, as well as treatments and preventions for it. Before anything, we first have to know what albinism is. So what is albinism? Albinism is a rare genetic disorder that can cause skin, eyes, and the hair to have little to no color. Since melanin contributes to the development of optic nerves, this disorder can also be associated with having vision problems. According to the National Organization for Albinism and Hypopigmentation, at least 1 in 18 to 20,000 Americans have some type of albinism, and can happen to anyone with any ethnicity. The term albinism also generally refers to oculocutaneous albinism. Some signs that can determine if one has albinism is skin, hair, and eye color. People with albinism have a high chance at developing skin cancer since they are more sensitive to the effects of the sun. Genetic mutations are believed to be the main cause of albinism. Albinism is a condition that does not get worse over time and does not change the life expectancy of that person. There are several different types of albinism. Oculocutaneous albinism affects the hair, skin, and eyes. The first type of oculocutaneous albinism, or OCA for short, is OCA1, which is a defect pertaining to the tyrosinase enzyme. For OCA1, there are two subcategories: OCA1A and OCA1B. OCA1A is when there is an absence of melanin in the body. People with this subtype generally have very pale skin, white hair, and light-colored eyes. The next subtype of OCA1 is OCA1B. OCA1B is when the body is still able to produce some melanin. People with OCA1B generally have light-colored skin, light hair, and light-colored eyes. The person's color may also change the more they age. The next type of OCA is OCA2. OCA2 is less severe than OCA1. People with OCA2 have reduced melanin production due to a deficit in the OCA2 gene. OCA2 is most common in people of African descent and Native Americans, and may have light-colored skin with blonde, light brown, or yellow hair. OCA3 is when there's a defect in the TYRP1 gene. This type of OCA generally affects people with darker colored skin. Individuals with OCA3 typically have reddish-brown skin, hazel or brown eyes, and reddish-colored hair. OCA4 is when there's a deficit in SLC45A2 protein, which results in minimal melanin production and can be commonly found in individuals from East Asian descent. Ocular albinism is a result of the mutation of the X chromosome and mostly occurs in males. This type of albinism only affects the eyes and not the skin or hair. Individuals with this type of albinism have normal hair, skin, and eyes, however do they not have color in their retinas. Hermansky Pudlik is a rare form of albinism and has a deficit in one of the 8 genes. Lung, bowel, and bleeding disorders are associated with this type. Chidiac Higashi is the defect of the LYST gene, and people with this type of albinism have a defect in white blood cells and are prone to infections. Grishchelli syndrome is due to a defect in one of the 3 genes, is extremely rare, and normally results in death within the first 10 years of life. There are not very many causes for albinism. However, the main cause for albinism is defects or mutations that happen in genes and are passed down by the parents to the child. Mutations in one of the several types of genes can cause different types of OCA. For example, mutations in the TYR gene can cause type 1 OCA. Mutations in OCA2 genes can cause type 2. Mutations in the TYRP1 gene are responsible for type 3 albinism, and mutations in the SLC45A gene are responsible for type 4 albinism. OCA is inherited in an autosomal recessive pattern. This means that both genes from each parent are mutated. Parents of a child with an autosomal recessive condition may carry a mutated gene and may not show any signs or symptoms of them carrying the mutated cell. Albinism also mainly occurs because the genes that are mutated are responsible for either distribution or production of melanin. So if there's a defect with one of these genes, melanin cannot be produced or distributed. When talking about albinism, there are a few ways that an individual can be diagnosed with albinism. The main way that one is diagnosed is usually at birth. This is because the skin and hair color of the baby will be lighter than the rest of the family. Any apparent light patches on the baby is an indication that albinism is present. Other tests that can determine if one is diagnosed with albinism includes genetic testing, family history, an eye examination, reviewing of the person's medical history, as well as a physical examination. When reviewing an individual's medical history, the doctor will generally check if there is bleeding that cannot be stopped, unexpected infections, or excessive bruising. The skin color will also be compared to not only the parents, but also with other members of the family. Doing so will help determine if they have albinism. An eye examination can also be done. During this, the ophthalmologist will assess the baby for nystagmus, strabismus, and photophobia. A test called an electrodiagnostic test can also be done. This is when small electrodes are placed on the scalp in order to test the connection between the brain and the eyes. During a physical examination, checking of the skin, hair, and eyes is also included. Since almost all forms of albinism does not affect an individual's lifespan, they are usually able to live a normal lifestyle as everyone else. People with albinism may have some problems with their vision due to the lack of pigment in their retinas. However, seeing an optometrist can help cope with their impairments. People with albinism have little to no pigmentation in their skin. As a result, the skin and eyes of these individuals are more sensitive to the sunlight. They are more prone to obtaining skin cancer due to the UV rays that the sun emits. UV rays can also cause vision loss in some people. With proper education about the person's condition, they will be able to avoid being at risk of skin cancer. Things such as wearing sunblock, some protective clothing, and limiting their daily activities will be able to avoid the risk of getting skin cancer. Symptoms of albinism will include the skin, hair, eye color, and vision. Since there is a lack of pigmentation in the skin, one skin color may be pale or very light. Exposure to the sun causes freckles, moles that either have or do not have pigmentation, lentigines, which are large spots that are like freckles, the inability to tan, and sunburns. A person's hair may range from brown to light to white. People who have reddish, brown, or yellow hair are generally from either African or Asian descent. One's hair color may also darken during early adulthood and may also darken with age due to staying from any natural minerals in water or from the environment around them. In the eyes, the eyebrows and eyelashes are generally light colored as well. The iris lacks pigmentation as also. A main trait that is in all types of albinism is vision impairment. This includes rapid eye movement, head movements such as tilting the head or bobbing in order to see better and reduce eye movements, inability for the eye to move in unison. The person may be extremely farsighted or nearsighted, photophobia, which is sensitivity to light, defect in the retina, misrouting of the optic nerve, and the person may have poor depth perception, and lastly is legal blindness or complete blindness. With albinism comes along not only complications, but also ways on how to cope with this condition. Some complications that were addressed before are not only visual and skin complications, but also social and emotional complications. Some visual complications can cause learning difficulty for an individual, impact one's employment, as well as the inability to drive. Albinism can cause an individual to have sensitive skin. The skin is sensitive to the sun and exposure to light. One of the serious complications because of this condition is getting sunburns. This is the most serious complication because it can cause skin cancer as well as damage to skin. People with albinism may also experience social discrimination. People can leave a negative impact on people with albinism because of their reaction to the people with this condition. Bullying and teasing are also things that people with albinism may experience, as well as questions regarding their appearance, any visual aid devices, or about their eyewear. People with albinism may feel like outsiders to their family due to their appearance. Some lifestyle remedies that can be done at home are using low vision aids, using a handheld magnifying glass or a magnifier that can attach to glasses can be used in the classroom to help make things easier and more comfortable. Adjustments can also be made at school or at home to help a child with this condition adapt to the classroom setting. Educating the staff at school about the child's condition may help them to gain an understanding and take action to make the school experience easier. Adjustments such as sitting at the front of the room or using a textbook with large print will make it easier for the child to read due to poor vision. Any handouts of the things that are written on the board can also make it easier for the child to read and keep up. Dimming the lights or avoiding bright lights may also be needed since the eyes of people with this condition are sensitive to light. For any emotional or social issues, you can have the child talk to you about their feelings, which may help them to feel better. Offer them encouragement or find a support group to help them cope with their condition. While albinism in general is not a life-threatening condition, there are some times where a doctor might need to be contacted. Some situations where a doctor might need to be contacted include if the child is having frequent nosebleeds, easy bruising, and infections. For a newborn, a doctor should be contacted if the baby is showing signs and symptoms of albinism. The doctor should be contacted because all of these are symptoms for the different types of albinism, such as Hermansky-Pudlak syndrome or Chidiac-Higashi syndrome. While these are very rare cases, there are still serious cases that are life-threatening that also include albinism. Since most forms of albinism are unharmful, there are still some precautions that can be taken to prevent skin cancer or any forms of skin damage due to people with this condition being vulnerable to the sun and sunlight. Wearing sunglasses can help protect the person's eyes from the sun's UV rays. Wearing protective clothing and sunblock can also help protect the skin against UV rays. Wearing eyeglasses can help correct any vision problems, and sometimes surgery can even be done on the muscles of the eyes to correct any abnormal eye movements. Medications can also be used to help boost pigmentation in the hair and skin and can also result in improved vision. That is all for this presentation, and I hope you have a good day.